I know this thing is on, and I know that you can hear me. Nursing and healthcare needs advocates and activism. So what are you waiting for? Let's do the damn thing. Hi, and welcome back to The Gritty Nurse, an unfiltered conversation about healthcare, nursing, and the intersection of health politics and policy. My name is Amie, and I am The Gritty Nurse. This podcast examines hot topics in healthcare and discusses the changes that we need to see to have a more efficient, robust, and ethical healthcare system that is safe not only for the patients that we see, but also for those who work in the system as well. Sorry, no fluff here, just awesome, compassionate humans and a lot of grit. If you're watching on YouTube or listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, please hit that subscribe button so you never miss out on any real stuff from The Gritty Nurse. We are at a crossroads. We've seen the headlines about hallway medicine and the desperate need for more staff. But we're standing at the edge of a new era, one defined by artificial intelligence, digital transformation, and a shift towards proactive team-based care. The question right now is, how do we innovate and take risks necessary to modernize without losing the safety and human connection to make our system one of the most trusted healthcare systems within the world? How do we move from a system that reacts to illness to one that actively builds on the health of every Canadian? Today, we're joined by a woman charged with answering those questions. On May 13th, 2025, the Honorable Marjorie Michel made history as Canada's first Black Minister of Health. From her roots as a social and organizational psychologist to her years as a top federal strategist, she's always been a first and a builder. Now, under Prime Minister Mark Carney, she is spearheading some of the most ambitious changes that we've seen in decades, including the landmark Connected Care for Canadians Act. Whether you're a nurse on the floor or a parent worried about your youth's mental health, or simply a Canadian wondering when the system will not fail you, this is a conversation that you do not want to miss. Welcome the Honorable Marjorie Michel to the Gritty Nurse podcast. Thank you so much, Marjorie, for coming on to have this conversation with me. I am thrilled, a little nervous, but super excited to have this conversation with you today.
Thank you to you for the invitation. For me, it's like such a great opportunity to talk with you and to talk to your listeners.
Yes, and I think they'll be very interested in what you have to say. It is February, and one of the things I always say is, Black history for us is 365 days of the year. But I wanted to start off by asking this question to you. What does Black History Month mean to you?
I would say exactly like you, it's 365 days a year. But, thanks to Jean Augustine, who highlighted, this month, this February month, I was reflecting on this lately and I were relating the Black History Month to the three big pillars that my prime minister is always saying, now we are building, protecting and empowering. And I would say by building, I would say, Black Month history means for me building on the shoulders of those who came before us.
Yes.
And building our community stronger. This is what we are showcasing the whole month. And when I'm talking about protecting, I am referring to what all the achievements, all the fights we won that we need to protect and much more these days because we are living in particular difficult time. I would say we have to admit it. And in those times, racialized communities and Black communities particularly have to be very alert not to go back step. And when I'm talking about referring to empowering, I would say empowering for the young generation. The young generation needs to be empowered to know that now it's not time for them to ask if they have just to jump in and take their own space. Because if we are doing the work we are doing and we did for years, it's to give them the comfort and the confidence that this is their country and they have just to, to pile in as any other Canadian.
Yeah, I think that's so powerful. I think you're absolutely right in terms of building. and just building off of the knowledge and really recognizing those who came before us. And I think you've probably downplay yourself a little bit, because when I think about Black History Month, I think about like you, who's come before me to be the first Black Minister of Health, to be the first Black Deputy Chief of Staff to a Prime Minister, to be the first Black Chief of Staff in the federal government. Those are all those parts where you're building and putting that representation in place. So someone like me or another little girl who's young coming up can see that we can be in those positions too. And then I also like the piece that you said that, we have to empower our youth. And I think it's so important that we do. And we do take the torch forward. And I love that we don't ask for permission. That's me to a T. I'm just like, okay, I need to take up space. I need to be there. And I think it's so important that people continue to recognize that. And then lastly, not to go back. That is so important. I think we're seeing all the various different things that are transpiring throughout the world. And it's important that we recognize the history, we call it out for what it is, and we make sure we take active steps not to go back. So I love all of those points. I think they're so poignant, and they speak to the realities of what's happening today. Let's move a little bit into healthcare. Some of the work that you're doing really highlights about Black men, and also just looking at, how do we incentivize health? So recent reports show that over 75,000 men have died prematurely, largely from preventable causes. And how will your new strategy incentivize men to engage with primary care before they reach a crisis point in the ER?
Well, you need to first know that when I landed as a minister, I didn't thought at the beginning that I was going to learn a strategy around, boys and men, health and mental health.
Yes.
And it came from my tour, because when I toured across the country and I visited organizations, met with doctors, look at the numbers, suicide rate, even the diseases, I said to myself, there's something that is not working here. And we need, as we are the leaders, we have at least to bring a conversation. So the first time I did it, I raised it with my counterparts, all my provincial and territorial counterparts during my last federal provincial territorial meeting in October. It was not one of the topics, but at the end of the meeting, I told them, I'm going to share with you something that make me really uncomfortable, because I see the gap there, but I don't know what to do with it. And they were all, I was really surprised. Everybody was really like, oh my God, somebody's bringing this forward. And I said, well, it's our responsibility. We are the ministers of health. And men are part of the society like women. And addressing one is not meaning that we are not considering the other.
Right.
And this is very clear for me, and I want to emphasize this, because a lot of people know me as a feminist, which I think I am. But that doesn't mean, even to be a feminist for me doesn't mean that you are just not considering the others, So when I started to talk about the strategy, and I spoke with organizations like November, and I held a roundtable with a number of organizations, it was very clear that the need was there. So what I am looking to get from the strategy that I'm launching very soon, we are going to have consultation, and I would like men to talk about their needs. This is what I am going to look for. I don't, as women, we don't like when people are taking decisions for us.
Right.
Which is great. Now I want to give the men of this society the opportunity to let us know as government how they want us to support them by asking help for their health.
Yeah.
And when I included the boys, it's because I feel we also need to work on the prevention side, because we are always reactive in the healthcare system, but we need to be more preventive, So, and talking specifically of Black men, of course, my strategy will address Canadians. So, within the diversity, and even if we know that men are less comfortable asking for help,
Right.
for me, that's normal, because for centuries, they were like the providers, the tough people. They were like, But that's not true. It was never true. But right now, we are in 2026, and I think we had a lot of progressive time in the world, like progressive movement. And I feel maybe also the men in general didn't know how to react to all those changes. But anyway, I do not know. I am just opening a conversation, and I want them to let us know. And after the consultation, from the result we will get, we'll know exactly how, as government and society and organization and even people and families, how we can support them.
Yeah. No, I think that's a powerful strategy. And I think it speaks to even understanding, the socialization that men have had around not having conversations about health. I think about, some of my own relatives, my own father, about, when we have conversations with health, I can't even think about him specifically talking to me about his health. It's kind of just this thing that happens to him and he doesn't really have a conversation about it. So I think that's really important that we have those conversations and that they feel open to having that conversation about talking about themselves in a very different way, talking about their health, talking about their mental health, and really showing young boys that that's a conversation that should start early, that they should be curious about their bodies, that they should be trying to have, talk about health and healthcare, and that they should be talking about mental health. And I think it dovetails really well to my question coming up, where we're talking about, adolescence, and we're seeing, I would say, some really disturbing things in relation to, social media in terms of how men relate. You talked about being a feminist and also the fact that it's important that men, have healthy, natural behaviors and having conversations. And I've seen some of that toxicity really circle around social media. And we are seeing that direct link between unregulated social media algorithms and youth mental health crisis, specifically concerning that rise of, toxic manosphere. We've heard the various different podcasts. We've seen the various different, very negative anti-women talking points. And while there's a talk of a national age limit for social media, what's the Ministry of Health's role in providing the clinical evidence and the school-based supports needed to help boys navigate digital risks before they reach a crisis?
I would say, yes, it's a conversation for now, and it's under the Minister of Heritage. So it's under Minister Miller, who is looking into it. I am part of a committee, a cabinet committee called Quality of Life, where we have those discussions where as a Minister of Health, I can add some value. But I would say for now, we need to first take a decision, which Minister Miller will do at a point, and then I will know exactly how I can support him clearly on the health side. And I am also including all these social media, gambling, blah, blah, blah themes in my strategy because it impacts a lot of young men, And so I would tell you, when I toured lately around the country, I heard two specific things coming from people's mouth. It was loneliness and lack of purpose. It was the two words that came back and came back all the time. And I write a lot, and this is how at a point I said, "Oh my God, 15 times the same word in 3 days."
Wow. Yeah.
So I think it's a we have to have all the health issues right now are very complex because they are not only regular health as we knew it before. You have so many things come into the society that has impact on health.
Right.
And so are we going to get to have some guidelines at a point where families can refer to? Maybe, but for now, I do not know. And this is why I am leaving the strategy very open because I don't want to talk for people. And I think this is something we have to make sure, because if we want to listen what men have to tell us, we have to have also the courage to listen to them and not having our free thinking, we are going that route or that route. I am waiting to see to get the consultation and the results.
Yeah, it takes me back to a conversation I had with another journalist where we were talking about, young boys and this whole conversation around loneliness and a sense of belonging and saying how important it is for us to have those conversations and to act on that. Because we do see, when men or really anybody are feeling, rudderless or directionless, they will seek out where they will find solidarity. And sometimes the groups that they seek out are negative ones. And we've seen where, young men and boys will join into various gangs, or they might join into groups that have very negative thinking about, different social groups where, you might see a young boy join the Proud Boys or just looking for that sense of belonging and solidarity because of those points that you mentioned, loneliness and, feeling that they don't know where they fit. And I think this is such a perfect strategy because again, this is where we're seeing where young men and boys don't really know how to deal with some of the emotions and feelings that they're having and that they feel that there's no sense of general direction. I think it's such an important conversation for you to do and to have because I do think mental health is a huge part. We talk about, some of the anger that we're seeing out of young men and boys and how to redirect that and how that they can understand that, anger is an emotion, but how do you direct that? How do you actually deal with that? And I think this is such an important strategy that you and your team will be doing and that you'll be partnering with the Honorable Mark Miller in relation to this work. And I think that, if we can build up our young men, build them up to have courage, to have conversations about their healthcare, to have conversations about their mental health, that we might actually really turn the rudder in terms of some of the directions that we're seeing. Because I think this is not just a national conversation, but probably definitely an international one as well. I'm going to move into my area of expertise, which is nursing and healthcare. And one of the things that we've seen a lot is, real issues related to workplace violence, nursing retention, safety and ratios. It's a huge conversation within the nursing role. So if provinces are failing to, enforce existing occupational health and safety laws or provide mandated nurse to patient ratios, which we know are related to violence, would you be willing to commit to making workplaces safer, looking at more metrics or maybe a mandatory condition for health transfer payments? Again, accountability is such a huge concern in relation to nursing, and no one really wants to take the reins when it comes to talking about safety for nurses. So how might your government be able to help and support?
I'll tell you, first of all, we came back with the chief nursing officer. As you know, Leah Chapman is there, and she's, I think, from what I heard from the Nurses Association, she's very present and doing a great work. I think, second, when you talked about provinces not enforcing, maybe, I wouldn't say that. I think it's very complex. The same way you are talking about anger that we are seeing everywhere. We are seeing it also, of course, in the healthcare system.
Right.
And nurses, because you are always at the front, you are taking it's like you are taking the first hit.
Yeah.
We had that conversation, I think, at my last FPT, and because we had a presentation from the nurses about harassment and violence, I think I already asked Health Canada to see how we can support them better by maybe like not advertising but raising awareness.
Mm.
And we are still having those conversations with the provinces and territories. You know, I would tell you something. Even if things are not great across the country in our healthcare system, I don't think I have one minister of health across the country who wouldn't like to improve their own healthcare system.
Right.
The challenge to, I can tell you with the differences, and I can tell you there's a lot of differences, regional differences, philosophical
Yes.
ones, and that's okay. They are also elected by their people, but they want to improve the healthcare system. We, for so long, I think we did business as usual that we all hit a wall at a point. And now we have to prioritize. So you can see some provinces prioritizing one thing that are so acute in their sphere and others doing another work. But I think all of them know this challenge of, the violence in the workplace. And I think it's also the nurses group, all those associations have to continue. And we are part of those conversations. They are working with Health Canada to know how we can better support them getting results.
Right.
But until the time that we will address the problem we just spoke before, you will face challenges.
Yeah.
As a lot of, women would face challenges and families would face, it's the same problem.
Yeah, I think you're right. I think people are really surprised when nurses share their stories and experience in relation to violence. I think that, having some type of campaign or, like you said, raising awareness around the fact that this is such a critical issue and that, we do need safeguards and things put in place to protect nurses. And you're right, we are at this kind of bubbling point where I truly believe, I agree with you that I think everybody really wants to do the right thing. They want to help. They want to support. And I think, again, it's so important that we listen to nurses' voices. We listen to nurses that are sharing their experiences at the front line, because again, it's great to have, these administrative roles that we have that might have been away from the bedside, but really tapping into that frontline nurse's voice, like we're having the conversation today, is so important, because I do know a lot of my colleagues, a lot of, other nurses feel that their voices aren't heard. And I think it's important, again, even just having this conversation today to raise the awareness to say, we are listening. The federal government is listening, and that there is some support and that there is some help that will be coming at some point in terms of, whether it's raising awareness or other things that can be done. I know you mentioned team-based care. I do think that's going to be the future of the Canadian healthcare system. I can't imagine how it wouldn't be. In any high-functioning team, leadership is based on shared expertise. And currently we have a national policy that's being designed, and physicians are always at the table. And again, I really think that nurses, who represent the largest portion of the workforce and the majority of patient interactions, were often viewed as, resources to be managed rather than architects in care. I know that we have the chief officer of health, but how might your government ensure that nurses, like frontline voices, are more present in policy decisions?
Well, first of all, I would tell you that, and I'm very strong on what I'm saying. I really believe it. You can hear more and more provinces talking about not having a doctor, but a health professional, even in Quebec.
Mm-hmm.
What does that mean? That means that finally we all understood that doctors cannot solve, and we won't ever have enough doctors to take care of the health of Canadians. And that now we have nurses that are well trained and that who are doing the work. And more they will take their space. When you say you are not at the table, I would say you can only be at the table first when you are asking to be at the table, because you have some kind of power. And I think it's, because of the history where, 50 years ago, we had doctors, and then the nurses were the one who were just doing some kind of work, and the doctors were assigning and being sometimes tough on nurses. Right now, nurses are well educated. They have not only lived experience, but they have strong backgrounds. They have they are experts. So they are becoming like they are expert in the healthcare system. And more you have provinces who are recognizing this. So I think because of the pressure, and now I think nurses have a big opportunity, because all healthcare systems are under stress.
Right.
Provinces and territories are looking to find solutions. Some governments in some provinces are really putting a lot of focus on nurses. Others are not, they are not there yet, but they are moving in that direction. So I think it's by engaging. And if I had a recommendation, when you want to be at the table, sometimes you need to remove your advocate hat and take your leadership hat.
Yeah, I
This is
think,
the only way you can shift from doing, the job to go to shaping policies.
yeah. I think that's so powerful. I think, when you were saying it, I was doing this in my head because I was just like, you're right. I think that nurses have to recognize the fact that there's so much more that we can do, but sometimes we might have to, like you said, take off the advocacy hat and put on the leadership hat. And I think that, physicians have their place. And I think physicians have to understand that at the end of the day, what is the main thing that we're trying to all do? We're trying to make sure that we serve as many Canadians and make sure that we're ensuring that we have a healthy community. And I think that's what nurses want too. At the end of the day, we all want the same thing, but we have to recognize when things aren't working. If the medical model is not working, how do we ensure that every care member of the team, whether it's a nurse, a pharmacist, a social worker, how do we make sure that we're all moving in the same, with the same beat of the drum to ensure that at the end of the day, that no patient is left behind? And that does mean including nursing voice. It means changing the way that we do things for us to operationalize all of our unique skills. Because again, what I'd say is we're all complementary. We're all bringing value. We're all bringing something so critically important, and we have to do this together. I've had this conversation time and time again, and I know some people might disagree with me, and that's fine. We can disagree. But at the end of the day, the main thing is making sure that, we don't have 2.5 million Canadians that have no access to primary care. We don't want to see people coming into the emergency department and using that as their sole reason for seeking out care. Or that's the last point where they feel that they can go get care. We have to do something radically different. And I'm glad that your government and other provinces across Canada are thinking about doing things different, because at the end of the day, we should not have anybody left behind. And we all need to be able to say, things aren't working. How can we do this together collectively and move forward? I think that's so powerful. One of the things that you also mentioned about is cutting red tape. I love that. We need to remove bureaucracy and make sure that we could do things as efficiently as we possibly can. And this is really in relation to, Canada's research community. In a practical sense, how does your department plan to streamline the clinical trial approval processes so Canadian inventions stay in Canada? Because I truly believe that Canada should be at the forefront. I think that we no longer can trust other superpowers of the world. Why can't Canada be that superpower? I think that we can. So what would you say we could how could we become the most trusted leaders in the world when it comes to healthcare?
Well, first of all, I would say, like in all the topics we spoke before about, it's a change of culture. I think like the healthcare system is working for 50 years, 60 years, the same way. Now everybody's saying, oh, it doesn't work. Let's move. Let's try to find another way. So it was just the same. On the health side, the posture of Health Canada was always protecting, protecting. So every time I think we got a problem, instead of looking to the problem, we were putting a protection. And then within the years, we added a lot of layers. What we need to understand right now is we are still Health Canada. So health is at the center of our mandate. So protecting the health of Canadians is quite the base of every decision. But now we are analyzing, do we need all those layers? What layer we can remove? How we can go faster? How can we use some work already done by some like-minded country? Do we need to repeat all the time all this very long and process that takes time? And we don't have time, because right now, I think you are saying Canada to be a leader. Before becoming a leader, we have to be in the game.
Right.
Right now, we are not.
Right.
So this is why I am pushing my department, and this is one of my top priority, because this is from my three priorities. It's the one that are completely on me.
Right.
At least on a part of it, like the approval, moving fast, removing the red tapes, facilitating the clinical trial. It's on us. It's nobody else. So I think, but it's a change of culture. And this is why I am on it like 24 hours a day.
I believe it. I believe it. And you're right. Like, we can't be contenders if we aren't, we aren't meeting the match. We aren't in the game. I love that. I think that we have such a unique opportunity, right? I think that there's so much that we can do. And I love the idea, but in relation to, removing some of the barriers and some of these steps that are unnecessary that we have that are that, might be a part of our history, but never were really moving the needle on things.
It's big. Well, we are for a long time in a lot of things. I feel because we are Canadian, we are risk adverse.
Yes.
We like
Very.
everything. Let's not move things too much, not doing a lot of noise, blah, blah, blah. But right now, we don't have any choice.
Yeah, we don't.
And we have to take risk. And we have some time to take risk. And maybe it will work, maybe it won't. And we have to be honest at the point to say, well, we tried this and it didn't work.
Right.
But we will move, we will still be moving because we have to move.
Yeah.
And at the same time, we need to keep the safety at the center of every action. So it's this part of being not only of this economic and effectiveness reality and the safety side that we have to balance. And this is what I am working to do because I am not a risk adverse person. I'm always ready to take risk. Always. Because I am also like, I'm not like a silly person saying, oh, let's do this, da, da, da. But I said, well, we need some time to try. And this is the same thing, on the healthcare system. I think I can see a lot of new initiatives that provinces are doing that are fantastic. Indigenous group also are putting a lot of new initiatives on team-based care. And the good news, provinces and territories, as the federal government, share with us all the best practices because we don't want to lose time. We don't have time.
Yep.
We don't want to lose time and repeat and try. And this, if something is working, let's try. So I think this, and I didn't speak about the artificial intelligence.
Ooh, we
because
should.
I will tell, I am 100% sure that we may speak in 2-3 years and we will have a very different healthcare system.
I agree with you. I agree. Yeah, I think that, sorry, go ahead.
No,
I think you're right.
Because of the number of things that I'm seeing on the ground, very soon, and it goes fast. And this is why we as a government, we have to have our strategy in place, and which Minister Solomon, the Minister of Artificial Intelligence, is working on. We need to have a frame because it goes fast.
Yeah, it's coming. And I think that's something we have to recognize. We have to recognize the fact that if we don't move and we aren't a part of it, change can bypass this, and we want to be innovators. And I think that, the idea behind doing something that maybe we haven't done before and just trying, because I think that's so important. In healthcare, we are very risk averse. We're like, oh, I don't know. We're so used to doing this. I can tell you, I've heard it so many times in my own life as a nurse is, well, why should we change this? We've been doing it for 30 years and it's been fine. It's like, no, it hasn't been fine. We're just used to this, but it doesn't mean it's making any change. It doesn't mean it's improving healthcare outcomes. So why not try something different? I think that's a radical and an amazing way of thinking. And again, we are still going to center safety. We're still going to center quality. And I also like the fact that, if someone's doing something that's working, why reinvent the mold? We should be sharing information. And I think that's so important that provinces do share that information and share that, hey, we've tried this. This is working really well. Why don't you give it a try too? Because that's how, we decrease silos and we work together. And because I think that's how innovation is powerful. And you're right. AI is coming.
Our innovations.
Yes.
If we don't move fast and if we are not embracing it, we will be buyers but not innovators.
Right.
This is the reality. And now we need to have our step on our own innovation.
We do.
The healthcare system, the healthcare space, is so active in innovation.
Yes.
That, for example, nurses, you have the opportunity to weigh in. Because you have the knowledge on the ground, the innovation still remains tools. Yes. They are not replacing people, brains, whatever. But it's tools that could help you in your work, in your daily work. So you need all of you to just, throw yourself in it embrace it, be active, and take the leadership.
I agree. I'm putting my foot in, and I'm going to make sure that other nurses put their feet in and recognize that we have to be at the forefront. We have to understand that this change is coming. And if we aren't a part of it, we won't have any say. So I agree. And the minister that's working on digital health and AI, please speak to nurses. This conversation has been just a wealth of knowledge, and you are just such an expert, so knowledgeable, so real and gritty. I love it. But before we wrap up, is there anything that we missed that we have not touched on today? And I'm sure there's probably lots, but is there one thing that might be burning that you want to talk about?
I would say, I think that I would just say that I know Canadians are very anxious these days. I can see it, I can feel it. I speak with a lot of people, not only on the health side, but across the country, all kind of groups. And as we are talking about, we are in the Black History Month, I would maybe speak particularly to the Black people. I know sometimes things can be tougher for a group like ours, I would say. But I think maybe every morning I would encourage everyone to tell themselves that right now I am a Canadian and Canada needs me. You will cross, when people are asking me, Marjorie, did you ever face discrimination? Of course, I would not face discrimination. Right. But I do not care. I move on. Because when I see a door closed, I move to another window and I will find somebody else that will take my idea. Yeah. And I think this is how we need to see the world right now. I don't need all people to like me or love me, no? But you will respect me.
Yeah.
I will firelize within the community, within other communities, with the whoever. And this is how we need to work today, is to make sure we are Canadian as everyone else. And we are at a time when we need to be responsible and we need to be grown up. Yeah. Because now, more than ever, and even more for those working on the healthcare space, our country needs us. Our country needs us, and we can help. And we need to know that. And we have this power.
I agree with you. Those are powerful last words. You are a powerful, powerful woman. And I think that, I hope that every once in a while you take time to take care of yourself, because I know you must be very, very busy. But thank you so much for...
I try to preach what I'm doing for myself. People say my team could be all quite my kids all the time. Well, but you have more energy than us. I said, yeah, but when I'm tired, I am tired. So right. I say I'm tired. When I'm tired, I said, don't put too much because I need to recharge.
Yes.
Because I think you can only give what you have.
You're right.
And if you don't have the vision, the energy, the positiveness in this space right now, as we are living those times, you're not useful. So this is why I think it's a duty to take care of myself. And as nurses, you need to take care of yourself also. Before going to burnout, before this, that, listen to yourself to know exactly where am I at. And don't look at others. Your level of energy is not mine. What you are living through today is different from what I'm living today. Those who have young kids, every situation is different. This is why do not care about what people think or say. You have first to listen to yourself, because to be like an asset for your organization, for your family, for yourself, you need to feel great.
Right.
And you need all the time to find this right balance.
Yeah, you're right. And I think that's one of the things I would say that, I would say as a Black woman that I don't do enough. I want to push. I want to make change. I want to be at the forefront. I want to make sure that I can do everything. But rest is also part of that work that has to be done. And I think it has to be something that's active. And I think we should be speaking to nurses and understand that there is a time that we push and that we lead, but also a time that we have to rest, and that we have to recognize those signs and symptoms within our own body And then, when we're rested, we could come back with even more grit. I truly believe that. So with that, thank you so much, Honorable Marjorie Michel, for coming on to the Gritty Nurse podcast, sharing your wisdom, your expertise, your knowledge with us, all the great things that are happening with the work at the federal government level. And yes, nurses will be there. And I know you said we'll talk in 2-3 years in terms of change, but I'm sure we'll keep in contact. We definitely have to, because there's definitely much more work that can be done between nurses and the federal government. So again, thank you so much for coming on the Gritty Nurse podcast. It was an amazing conversation, and I'm sure we'll get to meet sometime, hopefully in person.
Thank you so much for the invitation. It was a pleasure to speak with you for this little time. And we will see, I hope.
I hope so too. Yes, thank you. Take care. Looking for a great gift for a nurse or someone who needs to learn about nursing? Check out my national best-selling book, The Wisdom of Nurses, Stories of Grit from the Bedside. Thank you so much for listening to The Gritty Nurse with Amie Archibald-Varley. If you're watching on YouTube or listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, please hit the subscribe button so you'll never miss out on any awesome episodes from The Gritty Nurse. Thank you so much, and stay tuned until next time. Stay gritty.